Hello, you're welcome to the program Understanding Infertility with Dr. Abayomi Ajayi. This program, we're going to be talking about infertility in a language that everyone can understand. Today, we're starting from the very rudiments. We're looking at what is infertility to start with. The World Health Organization defines infertility as the inability of a couple to conceive after trying for about 1 year. That is, when they're having regular, unprotected intercourse for a time period of 1 year, if the woman is less than 35 years. If she's over 35 years, because we know there's a physiological clock in the woman, they should seek help after 6 months. So we look at infertility from the point of view of the age of the woman as well. And then we say when the woman is less than 35 years, we're allowed a time interval of 1 year. But if she's more than 35 years old, then we allow a time interval of 6 months. What are the causes of infertility? That's the question you're going to ask me next. We can say there are 4 main causes of infertility. The male factor, when the man is responsible, the female factor, when it's the woman, and then when it's the two of them which we call combined, and then the fourth one we say is unexplained. So we need to look at what are the investigations that we do for a couple that presents with infertility. Well, we can't do every test that is possible. So there are 4 main tests that have been identified as the minimum standard for you to do to investigate infertility. So the first one we do is to look at the semen parameters of the man, and the WHO assess standards for what is acceptable in this. And then we do blood tests to do what we say the ovarian reserve of the woman. In other words, what is the quantity and the quality of the eggs that the woman has at that point in time. And then we do an ultrasound scan, baseline ultrasound scan like we call it. Usually, preferably, this will be a vaginal scan, not an abdominal scan, because with the vaginal scan, you're able to see the organs in the pelvis better than an abdominal scan. And then we look at the X-ray investigation that we call HSG, or hysterosalpingogram, which is an X-ray of the tubes and the uterus, which we can, because we know that the commonest problem in this environment is whether there is tubal blockage. And sometimes we might have to do a procedure that we call laparoscopy, which I'm going to explain in subsequent episodes of this program. So the 4 baseline investigations are to look at the semen analysis, to look at the ovarian assay, or the egg profile, and then we do a scan, and then we do HSG or laparoscopy. And from this, we'll be able to identify about 80% of the causes of infertility. And that's why we say unexplained infertility, when we cannot see anything from this 4 tests, the incidence is about 10 to 20% in a population. So it's those people that we cannot see why they still cannot conceive that we categorize as unexplained infertility. Now, the next question to ask is, how do we treat infertility? Well, we can look at this from 3 main points. We can talk about drugs to treat infertility, we can talk about surgery, and then we can talk about assisted conception. That's all we can take for now. We'll continue this discussion next time. Always remember, together we can conquer infertility. My name is Dr. Abayomi Ajayi. Catch you.